All right, we are live, Crooked Spine, to interview again with Dr. Joel Kim. He is in San Marino, correct?
Yes.
Good. He has his own physical therapy clinic. He does a phenomenal job. Let's talk about why I want to interview him. It's hard to find a good, consistent physical therapy experience. With my patients that I have in my office, chiropractic patients, I'll send physical therapy. They'll go on their own too. There's so many different variations of what doctors do, what PTs do. I want to find out what Dr. Kim does. It's exactly why does he have such a great reputation in his community? Why is that? I want to pick his brain and see exactly what his treatments do that helps his clients get better consistently all the time. He's also going to understand too what his assessments are, what he does there, and how he figures out what's your problem. And I love that he works with understanding to communicate with his patients well, along with understanding what motion does too. So, Dr. Kim, to get started, what is the difference between a physical therapist and a doctor physical therapist? What does that mean?
Hey, Dr. Jody, thanks for having me on the show.
Of course.
So a regular physical therapist is, I think, what most people think of what a physical therapy does,
Yes.
which is, of course, treating the musculoskeletal system and wherever they may work. The doctor physical therapy, the D part, what that does is that in school, in PT school, we basically have had more training where we can do medical screening to see and make sure if the patient is a good candidate for physical therapy.
Good. Okay. And with that training, is that more hours at school? Is it more after a school training, or how does that work?
It's more semesters. So instead of like one semester anatomy and one semester kinesiology at the graduate level, is 2 semesters. So, for example, in my program, instead of one semester of anatomy of everything in the body, it was one semester of everything up, and then the other semester everything down.
There's more detailed involved then too.
Yes.
Good. And like I said, you know your stuff. I've worked with other DPTs too. Allows you to give you that person's well-being issue versus just their shoulder, just their wrist, just the elbow. Correct?
Yes.
That's part of it. And when we get into it, and how many years have you been in practice, Doc?
About 8 years.
Wow. And what made you
Almost
want to
in the
go into
double
private
digits.
practice?
I actually didn't foresee myself starting my own practice. I think a lot of maybe some people may relate to that. The reason why I want to start my own practice, well, the seed was planted by one of my mentors.
Okay.
And I was like, "You're nuts." And then a few years down the line, he was like, I kept chatting with him back and forth. He was like, "Joel, you'll never be happy unless you start your own practice." I'm like, "Look, this isn't me." And then it got to the point where the pain was too much to do what I was doing, that the gain to start my own practice was greater. And the thing that pushed me over the edge was COVID. So
why?
because the clinic shut down, and I had a wife and 2 kids that I needed to support. So I opened up my garage and started treating my friends and family, and it just went from there.
Wow. And you're the 7th, 8th story I've heard of where COVID was the push to start my own business, to go on my own, have my own practice, go solo for one too. You have no, I want to say you don't have any choice, but you really have no choice. Do I love this enough to do it on my own and figure out as I go? Right?
Yeah.
It's amazing when you have that drive to continue going, and in that drive too, now you have, I want to call it more resilience to get through whatever comes next.
The resilience is growing.
Yes, you're getting thicker skin, as my grandmother would say. And going through and going back to your practice now, what is your treatments that you normally do? Is it? I know you have different manual therapies you do. Let's walk through them and tell us how it's different, especially top 3: expert manual, function manual, and craniosacral.
So expert manual, it's more for the marketing paradigm, because when a lot of people go into physical therapy, most people think of massage and mobilizing the joints, which probably shoulder or the knee.
Okay.
The reason why we advertise expert manual therapy is because it's more than just the massaging, right?
Of course,
The tenderizing of the meat, the softening of the meat, and just getting the joints to move. What we do is that we take these different paradigms that we've learned, and in each of those paradigms, that they have different algorithms for solving a problem in an area.
Okay.
And we skip around in those algorithms based on our the clinical presentation, and we put all those pieces together in order to move. Like sometimes the solid organs need to get moved, or sometimes the dura needs to be glided. Sometimes the peripheral nerves need a little loosening and kind of thrusting through. Also, we find is what we also do is we use our hands to actually get the core to kick in much faster. So rather than 6 to 8 weeks of doing the bridges and then finally kicks in, we actually use our hands through the principles of PNF to get the core in that exact spot. And it may be in the shoulder or the neck or the hip or the ankle, the foot or the knee. And to get that to not just kick in, but to actually feel and so diagnose and so treat the timing of the motor response so that area is protected. So that's our expert manual therapy.
Well, I like that because you're actually allowing things to reset first and then get them to start working the muscle more on its own. So you're actually doing the reset on your own. You are, Dr. Kim, not the patient himself. So you know exactly what we're looking for, what's going on, use your experience and knowledge and expertise to make sure it's done right. Then you can start moving things around. The person can actually improve, like you said, a fast rate versus letting that body, you almost accelerate the healing naturally, but letting it do it on its own.
Yes, and so that's and you said that, Dr. Tony, right on, because that paradigm actually comes from the functional manual therapy approach.
Okay.
So I'm one of the few in the entire world that's a certified functional manual therapist, and the functional manual therapy paradigm is the functional manual therapy paradigm are three pillars. It's improving one's mechanical capacity. Okay. Second one is improving the neuromuscular function, and the third one is improving their motor control. So the mechanical capacity is if we want the body to move a certain way, if there's a block, that block has to get released. So that improves mechanical capacity. And once it's released and they have that full motion, then we train that neuromuscular system by evaluating and treating the 4 steps. So we're evaluating, treating initiation, strength, endurance, and ability to fully relax and elongate. Then once they have the 2, mechanical capacity, neuromuscular function, then we train the motor control, which is getting the system to do what's important for that patient. And if things are not right, that's okay. We take that small part, pull it out, improve the mechanical capacity, neuromuscular function. We plug it back into the motor control system. We hit the play button, and we see how that video plays through. And that's the paradigm of the functional manual therapy approach.
It's almost like you're trying to get everything to work together. So you're making sure it all is coordinating properly. So not one part is going to be the weak link of the system, correct?
Yes, that's correct.
Boom. And I like that because it's more of a person's well-being approach versus just a joint moving properly on its own.
Yes. So instead of like shoulder, just mobilize the glenohumeral joint. Mm-hmm. It's evaluating, treating the scapulothoracic joint, the thoracic cage to include the ribs, cervical spine, sometimes cranium, and it may even go to the elbow, wrist, or the hand.
It's almost, and I love that because you look at one joint, okay, that may be where the symptoms are, but what are the joints are controlling that joint that can throw things off than it should be, where it can't be as flexible, as strong, and have the endurance, like I said, ability to relax also.
Yes.
That's part of it. And what is the craniosacral therapy, sir?
So craniosacral therapy is manual therapy with very light touch, extremely light touch. It's
Okay.
about 5 grams of pressure, about a weight of a nickel, meaning that if you take a nickel, put it on your skin, that's how much pressure is being placed on the skin.
Mm-hmm.
And the great thing with craniosacral therapy is that it's really effective with patients who have acute conditions or fragile conditions. So it's a wonderful way to switch kung fu styles between the functional manual therapy approach and to craniosacral therapy approach. And the great thing about craniosacral, like I tell my patients, is helping the person heal inside out,
Mm-hmm.
where the functional manual therapy mechanically is more outside in.
It's amazing, and you're right up a chiropractic's alley too with the inside out approach. Is you're letting the body let you know what you can and can't do, correct?
Yes.
A
Do
lot
it.
of people go to physical therapy and there's only one way to do it. At that point, when there's only one way to do it, you can hurt someone and then I want to come back. When you think about what does the person need, how do I help the person today, then we progress to manual therapy, progress to functional manual therapy. We can do other things that over time can happen, but we have to start somewhere else and then work up to it.
Yes. And the reason why I studied craniosacral therapy is because my mentors in functional manual therapy, Greg Johnson and Vicki Johnson, Greg Johnson always challenged us to use our intuition and to treat the dura. And at that time, we're like, what? Like, it's about algorithms and research and critical thinking and, problem solving. And he's telling us to use our intuition and to treat this body part that we've never heard of before.
And let's go backwards for a second. What is dura so my patient can understand from a simplistic point of view?
Yeah, the dura is the most superficial layer of the Ziploc bag that covers the nervous system.
Good.
And then the Ziploc bag are the meninges, and meninges have 3 layers. The most superficial layer is the dura, also known as dura mater, meaning tough mother. Mm-hmm. And the middle layer is a arachnoid mater. And then the inside layer is the pia mater. Pia mater meaning soft mother.
It almost works together to, again, protect those nerves, that myelin sheath per se, allows things to work better. So if that works well, the nerves can work well too. It's all one system.
Yes.
And I like math in the sense where I use a technique called biophysics chiropractic, allows you to understand there's valid ways that you can show that a certain curve should be a certain motion should be a certain way. There should be certain, if we want to call it standards, we're trying to get to over time versus just guess.
Yes.
I'm good with math when it goes to that. When it tries to add the tip on $100 bill, I'm like, why does it have to be so high? I don't get it. I don't know.
Yeah, it has to go with also just knowing the algorithm. Mm-hmm. And then if you know the algorithm, which is exhaustive, right, you can use your training and experience to thin slice the algorithm to get right to where you believe that the problem is, which is the hypothesis. And then you just go from there.
And clarify me or tell me if I'm wrong too. The algorithm gives you different, if you want to call it hypotheses, what it can be. Then using your expertise, your knowledge, your experience allows you to kind of narrow that down to 1 or 2 things. So your action steps, your therapy will help get those 1 or 2 things better. Is that correct?
Yeah. It saves time.
Mm-hmm.
And it meets expectations.
And it gives you a way to quantify it, the person's results, correct?
Quantify and qualify.
Good. So the person helper is going to feel, but also this is what we're aiming for to get these numbers better per se.
Yes.
And going into private practice again and being an expert in your field and being, again, a great protection in the community over an 8-year period, why is mentorship so important? Off topic. This is off topic. Why is mentorship so important to get you where you are right now?
Because you can learn faster.
Mm-hmm.
It's much more effective to have someone who's made all the mistakes, and they're with you day in, day out, and they're with you in treatment, and they go, oh, not a good idea. Don't do that. Do this instead. Mm-hmm. And then you're like, okay. And then you do it. You're like, wow,
How do
how
you
did that
know?
work?
when
And
I
then
bought
the learning goes a little faster.
when I bought my practice, same thing too. I bought my practice, but also it was the previous owner coming back and going, "I'm going to teach you what I know to make sure you don't have to reinvent the wheel," right?
Yep.
I mean that's what school's for too. But school is good for knowledge because we have to pass the boards. But finding a mentor to help you learn how to practice, how to gain that accelerated learning, so you become your own expert over time. Those are invaluable people.
Yeah, the school just gives us permission, and it tells the public that, hey, we won't kill you.
Yeah.
And
Or if they do, we go collect their insurance.
yeah,
Right?
they're trained for the insurance system. You know,
Yeah, there's a people understand that. I mean, everyone has malpractice in healthcare. Malpractice allows you to a way to protect the world or people around it you treat from you if you do make a mistake, whatever it might be. But also our license tells us we've learned and we can practice a standard of care that is legitimate and is safe as much as possible.
it's very safe.
Mm-hmm.
May
Mm-hmm.
not be effective, but it's very safe. You're probably within two standard deviations, helping a
Mm-hmm.
person get better rather than like exactly what they need. Yeah.
No, and sometimes what they, as I found too, sometimes what the patient expectation is may not be enough. They want to just be out of pain. No, let's get you out of pain so you can now do this, 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 and this.
Yes.
Phenomenal. And Dr. Kim, walk me through your first patient assessment. What does your first initial assessment usually entail?
So it starts with the profile. So as soon as they talk to me, I'm listening to their tone of voice, their rate of speech, and male or female and such, and then that's where it starts. As soon as I interact with them, and then if they fill out my intake form, then
Yeah,
I further look at their patient profile. Right,
good.
male, 42 years old. Boom, already preconceptions, right?
Yeah.
And that's where it starts. And then they finally show up, and when they do show up, um, then I'll ask some clarifying questions,
Mm-hmm.
and then I'll watch them walk.
Well,
Um,
why watch them walk though? What is that? How does that help?
uh, because that's the movement that everyone does.
Mm-hmm.
And the walking, because when they come in and they're standing and sitting, I've already seen how they're standing and sitting. The hypothesis is growing.
Good.
And then when I actually watch them walk, and even can they relax while I watch them walk? Right.
Mm-hmm.
So that also gives me information. And I have them do a few steps, and I may take a video of their walking with their consent,
Good.
so that they don't have to do a million laps. They just
Mm-hmm.
do one or two. Then we sit down, and then I ask them what they noticed in their walking, what they feel and what they see, because now I'm at the point where now I'm at the point of assessing their prognosis. Do they notice their dysfunction?
Good.
Do they notice what's good and what's bad? And then I chime in and I give them permission to say, hey, it's okay. It's just what's top of mind, front of mind, boom.
Good.
Then I tell them what I see, and they're like, oh, got it. And then then I take to standing, assessing position. Then I put my hand on it and feel,
Mm-hmm.
and then I may twist or have them sheared. Now I add motion, and I'm getting closer to the diagnosis of what may be the primary driver. Then at that point, if needed, I'll have them sit, and then I'll check whatever's there. If not, then I'll have them lay on the table, and I may check them there if I haven't checked them sitting, and then I'll go straight into treatment.
And when you're checking them, how are you communicating with the patient as you're checking them?
I'm telling them.
Good.
I also usually have a mirror in front of them with
Perfect.
one of my skeletons next to them,
Mm-hmm.
so that they can feel my hand and compare their reflection with the skeleton right next to it, so that they can also see what I'm feeling.
It's amazing when doctors like yourself understand everyone learns different through touch, through sight, through hearing, through smell, even too. A lot of it is people. You want to educate. We same thing. We want to educate patients so they understand how their body's moving, sometimes improperly, and understanding how to get to a proper state, a proper standard. You're having them know exactly where they are right now and where you want to get them into. Boom.
Yes.
That's great. Well, and why is motion so important in an examination?
Because it's motion is part of the picture. Because there's also position and end feel.
What is end feel? Because some people don't know what that is. We do.
It's when you push on a tissue and you're assessing how that tissue pushes back or lets go in your hand. And we just keep it simple. Is it soft or is it hard?
Good.
And the great thing about assessing motion is that it's a biomechanical tool.
Good.
So it's useful for me as a clinician. And the great thing is that it's also a great tool for the patient and our client to notice what they're able to do or not able to do. And also motion is important for like documentation because it's easy to understand because it's very quantifiable. I think the great thing about measuring motion is that we can also measure it qualitatively.
Good. It's almost you're giving a way to quantify, but also qualify exactly how the patient is now, and then over time get into a better state of health, and understanding that by being objective like that allows them to see, okay, this is not you saying, I'm saying it's not what I feel, it's what it is.
Yeah, and to let them know that sometimes they're two different things.
And some people just don't know. People come in, they still say sciatica. They still say, okay, and they just don't know. They don't know what things are. They've Googled too much. Now they have too much Google in their brain, so it's all gooed up. At that point, we're trying to ungoo it for them. But again, give them, like you said, give them the grace to go, okay, I just want to hear your story. Let's work together to figure out what this is.
Yeah.
And which is key. How important is, we talked about communication, how important is touch being a physical therapist?
It's very important because I think the art of touch is being lost.
Huge.
Because just because we got the name doctor, we're doing a lot of talking to our patients, and we're doing a lot of reading of their charts, and we're doing a lot of watching them do things. It's okay to touch your patient. In fact, touching the patient gives you so much more information, and it's so much faster in gathering information instead of watching someone move and intellectualizing their problem. It's like, why don't you just put your hand on it? Is actually one higher and lower? What's the quality what's the end feel of the tissue? The other thing too is that when touching, it's also another form of communicating. There's three things that when I touch a patient that I'm trying to communicate. One is when I put my hand on a tissue and I move it, I'm communicating my intention for what I want that tissue to do. And the second component is my attitude about the patient. And so I'm always looking at the positive aspect of my patient. And
optimism. You're being optimistic.
Being very optimistic. And then the third component is what I say. And what I say combined with what my touch helps that patient on the table to kind of understand and so know and maybe intellectualize what they're trying to achieve. And I can use my words to guide their imagination to also help create the change. And so through my intention, my attitude, and my dialogue, I'm communicating even though it's my dialogue, it is congruent with my touch. And that creates trust. And so that creates the change in their body. The other parts of communication is also the whole experience. It's starting from the beginning. Like, hey, you're going to get this in a few minutes. I'm going to send it right now, and that starts the trust component. Communication is important for that trust, and even at the end of the treatment is when you wrap up the session. When I wrap up the session, it's okay. So you're going to feel this. This is the best way to manage that. And it's just like public speaking. I'm going to say this, you say it, and then after you say it, you say, this is what I said, right? And
you're reiterating what the condition is, prognosis, the hypothesis is that, and you're walking them through. And again, through touch, the person learns better through touch. They learn what you're saying, because they may not know the word you're saying, but I know what that feels like. That'll set an emotional response to the body to get them to remember that. He said the goal with everything we're doing in the initial assessment for either of us, anyone in healthcare, should be building trust with the patient.
Yes.
And then we help them.
Yes, absolutely.
If doctors, and I think maybe I'm on my soapbox right now, if doctors learn that, how do I build trust? How I communicate, how I touch, how I explain things, how I look for the patient to let me know how they learn, then that trust builds up. Then I can help them, and they'll listen and follow through to be compliant to see the results looking for.
Yeah, and part of the communication is also, hey, I didn't expect it to go that way. Sorry, it's kind of bad right now. Oops. Let's give me a chance to kind of do this instead.
It's almost like your body responded, I wanted to. At that point, let's reverse that and get back to where we should be.
Yeah.
As you know, everyone's
not
body
smooth sailing all the time, but we do try that.
It's called practice. It's not a perfect.
Yeah.
Right. Anything I missed that we talked that I sent the notes over for, and we talked a little bit briefly from the show you wanted to cover?
One of them was you're asking about where I got my passion and to keep the passion to help people, and I just want to give a shout out to my dad. That's where I got it from. He owned his own business, owned a driving school, and after he did his lessons, he would hold Alcoholics Anonymous, which I still don't understand fully why he does that. But that's where I got it from. Yeah.
It's amazing when we're in our practice seeing patients and we do what we do, then we do other things to help the community.
Yeah.
And sometimes they can intertwine, but sometimes when we're passionate enough, we want to extend that beyond our office hours.
Yes.
I think
it never feels like work. It just feels like
my wife asked me a few months ago, what's your favorite day of the week? What do you think it is?
Monday.
Huge. Got it, Doc. We didn't practice that. That's just huge. I love going to the office. I love seeing patients. And it's work. I love dealing with the good, the bad, the ugly. That's part of what we do. When we're passionate about it, we're going to be in practice not only for 8 years, but for 18, 28, maybe 48 years. Who knows? Now, I met a doctor this weekend at an event. He's retiring in 2 months. 67 years old, chiropractor. Been in practice for about 35 years. Loves the profession. He just wants to travel now. Healthy guy. Healthy body and mind, for one, too. When you're passionate what you do, you're going to keep yourself as a good example of what health should be. Phenomenal. And then, Doc, this is, I know we didn't, this is not very comfortable for you all the time, but you are, when you talk genuinely, you show a great passion for your field and to help your patients. So that hopefully kind of goes a long way.
Thank you.
You're welcome. Dr. Joel Kim, his website is on the show notes, Total Potential PT, along with get his 30-minute consultation. At that point, hey, I have an issue going on. It's a free consultation. It says free right there, right? Okay. Yeah. He may send you a bill for a copay. I don't know what's going on afterwards. Who knows? But also go to his Facebook post. Also, I'll post other things too. My takeaway from this is when you're genuine what you want to do and you can quantitate things for a patient, allows them to see over time a improvement in their care, not only number wise, but also quality of health wise too.
Yep.
And Doc, how would you wrap up the show? What's your takeaway for people to understand what you do?
The physical is emotional. The emotional is physical.
Huge, huge. And when the body is working together and both are doing well, at that point you can enjoy a long, healthy quality of life. All right. Doc, you did a great job today. Thanks for watching, everybody. I'm going to stop the show, then we'll see you in the back room for a second. Okay, Doc? Thanks, guys. Actually, one thing before we go, quick smile for 5 seconds. It gives me a point to do that for the image for the show, too.
Oh,
Right,
okay.